So let's review some of the nursing implications that accompany nutritional supplementation. We want to start with assessment, so we ensure that a complete nutritional assessment is taken. This includes a dietary history, weekly and daily food intakes, as well as weight and height measurements. We're going to consult with the registered dietitian, and in order to do that, we may include some other assessment pieces. That might be our baseline laboratory studies, like our total protein, our albumin, BUN, our red blood cell indices, our white blood cell count, cholesterol levels, which may include high density, low density, very low density cholesterol, as well as our triglyceride levels. You may be in charge of collecting some of the anthropometric data, such as skin fold caliper measurements, BMI calculations. You also want to assess for allergies to components of the enteral nutritional supplements like whey or egg whites, and assess for lactose intolerance. Remember, if we have allergies or lactose intolerance, we want to be sure those things make it to the permanent medical record in the allergy section. If we're administering enteral nutrition by tube feedings, we want to be very careful to follow facility policy for ensuring proper tube placement and for checking residual volumes before we administer a feeding. We also want to follow procedures for flushing the tubing to prevent clogging the feeding tube with formula. Remember, route is important here, so do not crush medicines and put them in the tube feeding. Make sure we're using the right formulation. We want to carefully monitor how the patient is tolerating enteral feedings. Keep in mind that most enteral feedings are started slowly and the rate is increased gradually. As I said before, our complete, we will usually, when we have those more natural, we will use them full strength. But some of our very hypertonic solutions, we're going to start at a half strength and go very gradually. So as we administer these, we want to monitor for signs of lactose intolerance. This would include things like cramping, diarrhea, abdominal bloating, and flatulence. For our TPN lines, follow the facility policies and procedures both for the care and maintenance of the TPN IV lines and the tubing and dressing changes. We want to monitor our patient's temperature and report any increase in that immediately, remembering that in spite of everything that we do, 2 to 3% of the population who get parenteral nutrition end up with a sepsis as a result of it. Because we're using high levels of sugars, our oligosaccharides, our dextrose, with these nutritional supplements, because that's where we get energy, we want to be sure that we're monitoring blood glucose levels using the glucometer. We're going to monitor for hyperglycemia. Signs of that would be headache, dehydration, and weakness, as well as for hypoglycemia, cold, clammy skin, dizziness, tachycardia, and tingling of the extremities. Now, with TPN, the pancreas provides increased amounts of insulin to cover the increased glucose levels. And we try and balance this more now than we have in the past by increasing the fat and decreasing the dextrose. But we still want to be careful about that and monitor the patient. If, however, the TPN is discontinued abruptly, we can get rebound hypoglycemia until the pancreas has had time to adjust to the changing glucose levels. So, for example, maybe your patient's taken off of the TPN, gone to do a test, they're in radiology, they come back, and for whatever reason, the TPN isn't reconnected. We can have a hypoglycemic episode as a result of that. If for some reason the TPN has to be discontinued, and we know it has to be discontinued, but it must be done abruptly, then we're going to use a 5% to 10% dextrose or glucose infusion to prevent hypoglycemia, and there will be a facility policy related to that. So be sure that you're following your facility policies. We want to monitor for fluid overload on TPN, particularly when we're on the PPN, but signs of fluid overload would include a weak pulse, hypertension, tachycardia. Remember, the heart is trying to keep up here and move that fluid as fast as it can. There can be confusion, decreased urine output. Maybe we have some kidney disease, excuse me, pitting edema. While the patient is on TPN or PPN, we're going to monitor daily weights and their intake and output. We're going to monitor for therapeutic responses to this nutritional supplementation. Some facilities actually have a formal nutritional support team that includes a physician, a dietitian, a nurse, could be a mid-level provider, a dietitian and a nurse, and the pharmacist. And so this actually has been shown in the research to decrease the rate of complications from both enteral and parenteral supplementation. So when we monitor the patients, we want to make sure that they're monitored for both the adequacy of the treatment and to prevent the complications. So how do we measure that? Well, we know that there's improved well-being. The patient will have more energy. Their daily living, their activities of daily living will be increased. They'll be able to perform some of those. And it's really important that we monitor because nutritional supplementation is really based on estimates of nutritional requirements. And so because it is that, just estimates that we're able to use, it's actually pretty imprecise science, but frequent reassessment will help us to make sure that the patient is actually gaining weight, their hydration status is adequate, and their overall clinical status is improving. If they don't appear to be responding, we can then look at nitrogen balance, and when they have a positive nitrogen balance, they usually are continued on the current treatment plan. But if they develop a negative nitrogen balance, then they change the caloric intake or the protein intake, and then they reevaluate. Of course, laboratory studies that reflect a more positive nutritional status would include our electrolytes, serum glucose, phosphorus, magnesium, calcium, those chemistry panels, BUN, and we may also look at the red blood cell indices, folate, zinc, and copper. So important things for us to think about and to monitor as we're taking care of these patients with the nutritional supplementation. As always, if you have questions, please post them in the discussion forum. Give me a call, give me a text, give me an email. I look forward to seeing you soon. Take care.